Pinched nerve is real.
I've broken bones. I've had third-degree burns. I've had surgery, and nerve pain is the worst pain I've ever had. I've had lots of injuries, James. My first, because I've had more than one, radiculopathy, the pinched nerve, right? In the neck was when I was like,
wow. Because then you could have a surgery on the wrong level.
I've seen that so many times.
Or a procedure in the wrong structure. Completely being treated by one practitioner with the wrong diagnosis.
I've seen patients have knee surgery and they hadn't.
Spine medicine, almost 3 decades. We used to tell people, the moral of the story, if you're going to get a spine surgery, you probably should have. This is our very first podcast, sitting here with my partner and one of my best friends. The very first podcast we've ever had.
This is the first one I've ever done.
Very first one. So we'll do this and cheers.
Cheers,
This is pretty cool. Cheers. So we're just here to talk about our lives and the spine, our practice.
Cool.
So for anyone who's watching this, Azmi is our medical director, my partner. He leads our program. And tell them about life, Azmi. You grew up in Southern California.
Yeah, I'm a San Diego kid.
Yeah. You've got 2 daughters.
2 amazing daughters.
And a wife that you
most amazing
were
wife.
reaching when you got married because you didn't deserve her.
Totally. There's always a reacher and a settler, and I was the reacher.
For sure. And so you had an injury, and I mean, we'll get into it, because I remember when you joined us, you had an injury that kind of directed you a little bit with the specialty you were going to take in medicine, right? Is that correct? Or
I've had lots of injuries, James. That's probably helped guide me towards musculoskeletal and pain and just being interested in like sports injuries. Yeah. I mean, my first, because I've had more than one, radiculopathy, the pinched nerve, right? In the neck was when I was like 20 years old.
Wow.
Doing a dive roll over a Buick.
So Dr. Nasser is a skateboarder and snowboarder. He's a really good snowboarder.
Yeah, but that was martial arts.
That was
a martial arts thing.
Okay. So what did you do? What did you do with that injury? Tell us about the fear, you know, how you got treated, what it eventually, tell us about it.
Well, so it was, you know, right when it happened, like when I landed and did the dive roll, I felt the grass just like graze my head. I was fine. You just jump up, you know, you're young. I just jumped up and I was fine. But the next day I woke up, like the worst pain in my neck and down my arm. It felt like my elbow. I thought something was wrong with my elbow.
Okay.
It was just like a hot poker, like in there.
So you dove over a car?
Yeah.
Okay.
Over the hood.
Were you drinking?
I don't have that kind of hops.
You were 20. Were you drinking?
No, I was sober. Yeah.
Okay. So you wake up and it was tricky because you probably thought you had broken your arm, not knowing you weren't a doctor yet, right? So you didn't know.
No.
You didn't know what was causing your pain.
I thought like something was wrong with my elbow, but like nothing. I could move it. Nothing was wrong. But if I moved my neck, the arm hurt more. So I knew it was my neck, like just figuring it out. And I didn't go to martial arts for like a couple of days, and that's not like me. So my instructor actually reached out and was just like, hey, you haven't been here for 2 days. Like, what's going on? And I told him I was hurting. He's like, you need to go see my chiropractor. So I saw Dr. Padilla down in Carmel Mountain Ranch, and I actually went back to like recently, like a year ago, to see if he was still there, because this is like almost 30 years ago.
Wow, you're getting old.
And he wasn't there anymore.
But he took care of you, so he helped you.
He did such a great job. Like the first day, he didn't even manipulate me. He just did gentle decompression, some myofascial release. Mm-hmm. I could tell everything on the left was super tight. But then I saw him again a couple of days later, and he gave me some stretches to do, and I was doing that for a couple of days. When I came back and saw him, he did manipulate my neck, and all the pain was gone. That scared you, didn't you?
That scared you?
No, it was fine. I've been to chiropractors before. Okay. That was fine.
Okay.
I've been a fan for a long time.
I'm glad you're a fan.
Yeah, I know you are. And then all the pain went away. So I was like, man, that was And
So-
I've been a fan since.
So mechanically, you're even though you're an interventional spine physician, you're trained in OMT, which
Yeah.
a lot of people don't realize. Osteopaths still do some manipulation. Mostly chiropractors do it
Yeah.
today and PTs, but osteopaths used to do it. They're still trained in it, and so yeah. So today? You see patients with radiculopathies every day.
Yeah, all day.
I mean, all day long you see that.
Yeah.
So, how has your appreciation of that condition changed after being a patient? I mean, you were your patient.
Well,
yourself.
I can sympathize with the patient for sure and realize like how it's going to affect them and the struggle they're going to go through every day. Just
Pinched
even, like,
nerve is real. It's real. It's real
Oh
pain.
yeah, that's nerve pain. I've broken bones. I've had 3rd-degree burns. I've had surgery, and nerve pain is the worst pain I've ever had. Like I broke my shin, and then
So a fractured bone doesn't feel. I've never had a fractured bone.
I said that was a 2. Pinched nerve, especially like I had trigeminal neuralgia. That's like a 10.
So trigeminal neuralgia, that's in the brain. That's facial stuff.
Yeah, that was right
Yeah.
here. Oh my gosh.
That was a 10. So, all right. So in our office, we see people with pinched nerves every day, but we also see patients that have referred pain that seems like it's a pinched nerve, but it's really not. So share with, from a spine expert's point of view,
Yeah.
how that kind of presents and how you differentiate those two things.
Okay. Well, I'm gonna first start off with a personal story again.
Okay, good.
Just from like
Yeah.
a month ago.
Okay.
I was working out and I tried to take a workout to the next level, and I think I like hyperextended my low back, which I'm usually very careful to do. You know how like into core strengthening I am.
Yeah.
And I felt something in my back. I'm like, oh, my workout is done. And then I went and like did stretches and all that stuff. And every day across my low back, it bugged me. And the test we did, facet loading, was totally positive. And I was like, okay. And
So what facet loading? Share that with people listening.
So can I have your spine model? Maybe also people
here you
can
go.
see it.
For sure.
Well, these are the facet joints. So
Okay.
the spine has basically a front and a back part, an anterior and a posterior part. The front is the vertebral body and the disc. And really the middle is the spinal canal and where the nerves come out. And the most posterior back part is the joints. And so the joints help restrict like extension, but they also add some stability. Yeah, bending backwards. But they add some stability to the whole structure. And I just jammed my lowest joints, just
So a month ago, you jammed your lower joints in your back, exercising.
And then 3 days later, when we were traveling and I was sleeping in not my own bed, I could feel it loading more. And then the next day, I felt this pain like into my buttock and down my thighs. And my first concern, because like a pinched nerve radiates, I was like, oh my gosh, did I like hurt a disc? Do I have a radiculopathy or pinched nerve or the proverbial
You're worried about
sciatica?
serious spine pathology,
Yeah.
serious spine injury.
So I did all the neurological tests on myself, and they're all normal. And I realized I have facet referred pain, and it's real. It like really radiated.
So as a patient, you wouldn't know whether it's a pinched nerve or referred pain. It's
No.
as a doctor, even the doctor who's an expert at this, you had trouble telling the difference.
Yeah, I had to. So the key is a physical exam will tell you. A really good physical exam can help elucidate what is going on. And I didn't get an MRI in the past month. I know what older ones look like.
And the treatment's a little different.
Yeah.
I mean, I know every patient's individually different. You look at them, there's lots of factors that come into play when you determine the approach you're going to take with your patient. But a pinched nerve is treated differently from an interventional pain physician's point of view than referred pain, right?
Yes, because you're dealing with different structures. Are you treating the nerve, or maybe the disc that's leaking chemicals and irritating the nerve,
Yeah.
a disc that's herniated and pushing on a nerve, or are you treating just an inflamed or jammed facet joint that's on the back part of the spine?
Yeah. So which of those procedures do you do more frequently in the clinic? Are you treating more referred pain, which we would say, or are you treating more true pinched nerves? What would you say when in the clinic, you're kind of your, just a guess.
You know, I think it's probably about 50-50.
Okay. All right.
Yeah.
And the ability to heal from one of those injuries, one's a lot easier to heal from than the other.
Yeah, I feel like it depends on the severity of whichever injury, right? No injury is the same, but if you have a disc herniation and a pinched nerve, that's probably harder to heal from than facet arthritis or facet referred pain. There are, of course, interventional treatments where we try to put out the fire and turn off the pain. The key to both, no matter what, though, is core strengthening, watching your posture, right? Because I tell patients, like, I'll put the fire out. I can turn off that pain signal. But if you keep doing the things that are lighting those fires, then it's going to come back.
Yeah, it's tough for our population. You know, we sit all day long, we sit in cars, we have weak cores, and then we wonder why our spines hurt.
Yeah, I don't think we're meant to be sitting like that all day, working on computers.
Yeah.
We're also not meant to like bend and lift and twist things. Of course, you can lift things, but if you have proper body mechanics, then less likely to injure yourself.
Yeah. So as far as treating pinched nerves with an epidural steroid injection or a PRP injection or a surgery, those are some tools we use in our office. Share with the folks that are listening your experience with PRP. Go ahead and share it. Platelet-rich plasma. It's a type of injection you do, right?
Yeah.
Share with the population some of your experience and what's with our listeners some of what's going on in that space and what explain to them what a PRP injection is versus an epidural steroid injection.
Okay. Let me start with the epidural steroid injection because that's really the most common performed procedure for someone that has a radiculopathy or sciatica or the pinched nerve. And so when a disc is injured or when a nerve gets pinched, causes inflammation, right? And there's certain chemicals our body produces that signal that we have an injury and cause even more cells to come in and inflammation. Inflammatory changes. So all steroids do, one is the volume that we put in there, whether it's with a numbing medicine or even just normal saline like sterile water. It just dilutes all those inflammatory chemicals. And then the steroids help decrease their secretion, decrease their inflammatory effect. And so usually that's what I say is we're trying to put out the fire. Right, but it's not healing anything, really. It's just decreasing inflammation.
So it flushes out the bad news into the area, and it also does something to the nerves, to the receptors. Is that what you're saying?
Yes.
Okay.
Yeah.
Okay.
Yeah.
All right. Cool.
And so for the past 10 years, we've been doing a lot more regenerative medicine injections, platelet-rich plasma being the most. So platelet-rich plasma is where we would draw blood and then we centrifuge it a couple of times, really concentrate the platelets, and instill that usually with some normal saline and probably some different numbing medicine just to make it more comfortable. And it does the same thing. It'll help dilute the bad news. I like how you said that. But the platelets then find where the injuries are, usually the parts of the disc that are injured, even parts of the facet capsule that are injured, where the nerve might have some injuries, and they attach, and then they signal their buddies to come in and help clean out those inflammatory chemicals and even come in there and try to repair some damaged structures like the ligament around the disc, say, or the ligaments around the facet capsules.
So they're actually fixing something in the soft tissue. They're trying to repair something.
Yeah, they're trying to repair.
Not just put the fire out like a corticosteroid.
Yeah.
Yeah, that's cool.
That's cool. So, we do a lot of epidural steroid injections, but I haven't had a steroid injection in over 10 years. All my treatments are now regenerative.
And my treatments that are regenerative, provided by you.
Yeah.
Of course. If you have an opportunity to not use corticosteroids, and you can use your own cells, that's pretty cool.
Yes.
Yeah.
Or even if it's not your own cells or other allografts, that we can use for certain things, like not so much the pinched nerve, I don't think, but, like I have hip arthritis and I have a labral tear, and we've put different allografts in my hip.
I've got a
PRP
pretty
in
great
my
story
hip.
about that too. Don't
Okay,
I?
tell your story.
Well, you know the story. So 9 years ago, I tore my labrum, and you were my doctor, of course. And I looked back in my medical records because I obviously, you get older, you confuse things on the length of time. But I actually went back and looked in our electronic record. And I don't know if it was 9 years ago, roughly 9 years ago, you injected my hip because it was getting so bad from a labral tear. I couldn't walk more than 150 meters, and I felt like an old stick. My hip would be killing me. And you injected it with my own platelets. So you did a PRP injection. I thought it only worked for 4 months, but it actually worked for 10 months. So 10 months you injected me the first time with PRP. And then you pulled my own bone marrow. So Dr. Nasser pulled my own cells, my own bone marrow, aspirate, concentrate, pulled it out of my iliac crest and injected it back in my hip. That was about 9 years ago. And it fixed me. Now,
We put
I
some
don't
in
go
your
run.
toe too.
Yeah, he put some on my toe, my knee too. That's right. I'm getting old. But it fixed my hip. Now, I do the right exercise. I do the right core. I'm not going out and running a marathon, but yeah, platelets worked for 10 or 11 months, and bone marrow aspirate has worked for about 8 or 9 years with me. So
Yeah.
that's a fact, Jack. That's real. I mean, that
Yeah.
worked on me. Did you? Who injected you with your hip? Did Dr. Ghaffari or?
Dr. Ghaffari has injected
Okay.
me. Our amazing PA Avi has
Okay.
injected me. Our former amazing PAs have injected me.
Okay.
I was continuing to hurt my hip because I wasn't listening to my own body, because I liked riding my bike to the gym, and it just kept impinging it, And so once I figured to stop doing that, and just doing the right exercises, my hip hasn't bothered me in years now, actually.
Yeah.
So
Being told that you have an arthritic hip, you're gonna have, or an arthritic spine, and you're just gonna have to learn to live with it, is nonsense a lot of the time, right? It's nonsense.
there's
It's kinda
always
old
something we
school.
can do. Yeah.
Yeah, that's kind of old school advice. We used to tell people, I've been in spine medicine almost 3 decades, you have non-specific back pain. You have non-specific back pain. We don't know what it is. Well, that's not true, is it? With a
No.
good physical exam and a diagnostic evaluation with the diagnostic procedures you perform with short-acting anesthetics, you can identify the structure and tell a patient what's causing their pain, right? I mean,
Yeah, absolutely. I love to try to identify where the pain is coming from. That's key, because otherwise you don't know what to treat and you don't know which path to go down.
because then you could have a surgery on the wrong level
I've seen that so many times.
or a procedure in the wrong structure.
Yeah.
Right. Or completely being treated by one practitioner with a wrong diagnosis.
I've seen patients have knee surgery and they had an L3 radiculopathy the whole time. The knee surgery didn't do anything. And then I do a diagnostic knee injection and their pain doesn't go away at all. Their knee still hurts, even though it should be numb. Like they feel like it's heavy, and numb, like when you go to the dentist.
Yeah.
But their pain is still there, and that's because it's a pinched nerve in the back telling the brain that where this nerve innervates, which is the knee, is
Yeah.
what's hurting.
So the moral of the story, if you're going to get a spine surgery, you probably should have an interventional spine physician working with your spine surgeon, right?
Yeah, I think
Man,
teamwork makes the dream work.
Teamwork makes the dream work, because then you're for sure going to have the right structure operated on. Spine surgeons are brilliant, but interventional pain physicians and spine surgeons working together is better.
Yeah.
Right? I mean, that's better.
And most surgeons agree
do
with
that
that,
anyway.
too.
They agree
Yeah,
with
they
that,
say, hey,
for
do
sure.
this diagnostic block for us.
For sure.
Yeah, tell us if this is where the pain is coming from.
Good stuff. So another question before we finish up here, and I know some of these answers because I've known you for 15 years, but who was a mentor for you? I mean, who share with us some mentors, some people that really affected you in your life and gave you some of the confidence you have that you display and in the clinic and with your family. I mean, who's a mentor for you? Who helped shape you? I know your parents.
Yeah.
I met your parents. Are
Number
special
one,
people.
I was going to say my parents.
Yeah.
Number one. Number two is my martial arts instructor, Brian Manna. And
He's been in the clinic. Yeah.
We've treated him.
Yeah.
We've done regenerative treatments on him. And he's like a second dad to me because he helped discipline me and shape like my confidence and my character a lot, especially during those formidable years when you're just a punk,
I was a punk for a long time.
Yeah. And so them two. But then like going into medicine, I feel like I've been blessed to have a lot of mentors, and even friends in medical school have been mentors. But I remember considering orthopedic surgery or family practice sports medicine. Those were the two paths I was going to go down because I really liked musculoskeletal medicine. And a friend who's a radiologist talked me out of orthopedic surgery. And then the orthopedic surgeons talked me out of family practice sports medicine. And the surgeons I was working with actually suggested I shadow their friend also, Dr. Michael Jaffe. I encourage everyone to read his book. I tell so many of our patients to
Golfing
read his
for life or something.
Play Golf
Play
Forever.
golf for life. Yeah, play golf forever.
And so I shadowed him for like 3 days once, and then came back and I did a couple of rotations with him. And he was an amazing mentor, and I really like his treatment style and what he could offer patients. Because in physical medicine and rehabilitation, he was doing interventional pain, but that wasn't really
a specialty,
subspecialty yet. But he was definitely doing those. So I was enamored with like the procedural aspect, but then the clinic aspect of connecting with patients and educating patients. Yeah. And so I got to stay in touch with him for the longest time. I probably should reach out again because he really put me on this path.
Invite him here to have a conversation.
Oh, that'd be fun.
That's a good idea. Yeah. The feedback loop is faster with interventional pain, isn't it? You get to see your patients get better, and you get to get that feedback from them. It's really cool. Versus other aspect. If you're a family practice doc and you tell somebody to change their diet, you may change that. You may save their life in 40 years. But if you're an interventional pain physician and you come in and you can't go back to work, and you put medicine in their back and you get them to go back to work, that's a quicker feedback loop.
Sure, it is.
That's cool,
and it's very rewarding for sure. Yeah. I have friends that are family practitioners, and I don't want to.
It's a hard job.
Yeah, that is a tough gig, and while I'm glad I got talked out of it, like I love and respect mine, so we're lucky to have them. Yeah. But definitely the more instant gratification is there versus like monitoring someone's blood sugars and blood pressure and their diet forever if they listen to you.
Yeah, our patients are really good. I'm so good at giving my own advice, but not taking my own advice.
I feel like I get hurt. When I'm getting hurt, it's because I'm not following my own advice. Yes. But we're all human.
This is cool, isn't this? Isn't this fun?
I'm having fun.
This is fun.
This is like our normal conversations
I know, but we get to
in
have
a bit.
But we can have this and give it maybe, and a lot of us BS, but some of it will be good for patients. They'll get some content here. Hopefully that will help them.
Yeah, I hope so. Yeah.
Very cool.
It's a way to reach out to even more people.
Yeah, we'll talk about different topics that are interesting to the people that we serve, our patients, and very cool. So, I guess this is our first foray into this field, man.
Cool.
So glad we did this together, man.
Yeah, cool.
Awesome.
Cheers, man.
Yeah, thanks, brother. Yeah, cheers.
Shake hands like when you try to handshake versus give a fist bump.